Well, hello and welcome to all of our viewers here today. I'm Fiona Lang Sharp, IBCLC, Director of Communications and MC here at Gold Learning. Well, we're here today talking all about our Gold Midwifery online conference, and we are excited that we are here today with Cecilia Jevitt. She is one of our presenters here at the conference. You can find out all about the schedule and details, of course, for this conference at goldmidwifery.com, and we'll be talking more about that in just a moment here. But let's introduce Cecilia to everyone. Welcome, Cecilia. It's great to have you here today.
Hi, it's great to be here.
Well, welcome, Cecilia, to, of course, Gold Midwifery. But of course, I am so excited to be sitting down with you here today, learning about so many things that you do. And of course, one of those things I'm very excited about is that you are here working in Canada now, but native to the United States and with an extensive career, so many things in between. So I encourage everybody to go to our website and check out all the things that, of course, Cecilia has accomplished. But I will let you, Cecilia, introduce yourself. Tell us a little bit about where you are and what is happening in your life today, and about your experience as a midwife.
Well, I'm in Vancouver, Canada, although I practiced in the United States for 35 years, most of it in Florida. And then I was director of midwifery at Yale University for 5 years. And now I'm directing midwifery in Canada. A little bit different style of midwifery, but I've been able to continue my work. Today, I'll be talking about obesity management during pregnancy, a topic that I got interested in about the year 2000. I was in the clinic one day, and at the end of the day, I realized that I had provided care to three women who each weighed
Hmm.
100 pounds more than I did, or more. Now, you can only see me from the neck up. I'm not a thin boned woman, I'm not tiny. Um, so for me to care for women who weighed well over 200 pounds was unusual. When I was a new midwife, if women weighed more than 200 pounds, they were considered to have high risk health and they were sent to obstetricians for their care. So I got very interested in what was going on because weighing 200 pounds or more was starting to be a bit normalized. So I started looking at obesity during pregnancy and wondering what was going on. That was at the start of what's been called the obesity epidemic. So
Mm.
for 10 to 15 years, researchers looked at obesity with growing alarm and really packaged it as an unhealthy medical condition that had multiple risks. And for pregnancy, that meant that women were given, this unhealthy label and treated very differently,
Hmm.
and sometimes denied the best of care. They were prevented from walking around during labor and maybe told that they couldn't give birth in birth centers. So my work has looked at particularly why some women with high
Hmm.
BMIs do so well in pregnancy.
Right.
As it turns out, eating healthy, getting enough sleep, and getting regular physical activity, things that just seemed so easy,
Hmm.
are the keys to staying healthy, even for women with high BMIs and keeping a pregnancy healthy. And even at the highest BMIs, somewhere 18 to 20% of individuals will have no other health problems, no diabetes, no high blood pressure. So we need to be able to recognize that and
Hmm.
really offer individualized care to women during pregnancy so that they have the best outcomes they can.
Absolutely. It's so interesting to me how a lot of the discoveries in maternal child health and in midwifery care has really sort of unpacked a lot of what we would have done in the past of just lumping everybody into one category.
Mhm.
Midwifery to me has always been that sort of ultimate individual care. But we have a society that already sort of, alienates, I think, folks with obesity, women who have obesity. And so it just perpetuates the problem when it comes to birth. I mean, I still see those stories today, Cecilia, of women not being treated well, because of their size and, not having choices because they're categorized incorrectly. This research is so important in order to provide that individual care. Are you still seeing bias amongst professionals, perhaps even in midwifery care as well, that don't have these types of tools?
Absolutely. Um, Providers are humans, and they grow up with bias that can take
Hmm.
a long time to shed. There's that old word you don't hear used very much any often, gluttony. It was, I think, one of the seven original sins. Just eating more than you should be. Um, to think of obesity as simply too much intake and not enough exercise is a very old fashioned idea. There's actually so many roots of overweight and obesity. As it turns out, we're so connected with the environment, which is kind of midwifery like thinking.
Hmm.
Our environment is loaded with endocrine disrupting chemicals, pesticides, plastics. I read a fascinating study this week from Italy where they biopsied a number of placentas and
Hmm.
found all of those placentas had microplastic particles in them, which can carry endocrine disrupting chemicals. And those chemicals act like hormones in our systems and alter our appetite, they alter our insulin sensitivity. So it sounds so far fetched, but if we're really going to do good care for people, we're trying to take care of the environment too.
Right. Yeah, I've heard about this before. Working in the lactation field, we've heard about the toxins that potentially are in, breast milk as well. Like we're very aware that, what is happening in our environment is very much connected to our bodies. But to hear that of, a disruptive, works as a hormone, this is very interesting because, potentially, the language that we've been using, the older research that we've been
Hmm.
using is just not accurate anymore. We
Yeah,
need to get up to date. And I think honestly, that's why I was actually very excited about having you come and talk about this topic, because I think sometimes people shy away from it. They don't want to talk about it because it's always had more of a negative connotation. And so therefore, women come away feeling like they've been told that they're bad again or something's wrong with them,
yes.
and doesn't provide either the practitioner or the parent anything to work with. But you're not talking about these things. And I'm just going to tell everybody what your title is because I love this too. Caring for 3 generations at a time, clinical prenatal care for individuals with obesity. And that really talks to how what we do now, we're investing in the future as well. Right,
Yeah,
Cecilia?
yeah. A lot of my colleagues, midwives, obstetricians, and family practice physicians, think birth is where it's at. They love birth. I I am awestruck by the prenatal period and
Mm,
our ability to influence health.
mm.
So it's pretty obvious if we're helping an individual with care during pregnancy, we're affecting that individual's health. For
And
the
that's just
for
fantastic.
Yeah, for the pregnant person, that person quite often is the food preparer and shopper for the family, so
Hmm.
that's influencing the health of the family around them. But eating during pregnancy also
Hmm.
influences the fetus in utero
Hmm.
and can change hormonal inheritance and the physiology of that child before birth. If the fetus is female, that female is carrying all of the eggs that she will have for the rest of her life. They're exposed to the pregnant circulation so that if there are endocrine disrupting chemicals or high blood sugar, epigenetic switches are thrown that persist in the egg until that egg is fertilized and
Isn't that
becomes an
incredible?
individual. It's crazy wild.
I
You
know.
know, another avenue that just fascinates me is our microbiome.
Mm,
So the flora in our gut, I don't think I talk about this at all, but the bacteria in our gut actually signal, they release hormones and chemicals that signal our brain about
mm.
appetite, insulin sensitivity. I just find that wild.
Yeah. And I can see why, because I think that, folks haven't been talking about it. It gives a brand new approach. It's again individualized to those that we're working with. So I have to say that I am very excited about the fact that you're going to be with us. I'm hoping that those that are listening in right now, you mark it on your calendar right now because it's going to give you the opportunity to come and sit down with Cecilia on the live event, which is going to be on Monday, 8th of February. Now, I want you to go to the website right now, goldmidwifery.com, and look at that conference schedule, mark it on your calendar. Of course, all our sessions will be recorded, so you're not going to miss out on anything. But of course, we love it when you come and join in those live events. Thank you so much, Cecilia Jevitt, for being with us here today. I know we're going to have a really awesome time together, just taking a deeper dive into this subject matter in our conference. So thank you for joining me here today.
I'm really looking forward to the full presentation. Thank you for inviting me.
Thank you so much. And again, if you're listening in right now, you can leave comments down below, and you can also go to the website at goldmidwifery.com to register for this conference. We'll look forward to seeing you all online. Bye bye for now, everyone.
Bye.